Good morning, everybody, and you're very welcome to our webinar today, which we are hosting as part of Science Week 2023. So for anyone that doesn't know me, my name is Carl Walsh. I'm the head of the research division in the Department of Agriculture, Food and the Marine, and I'll be moderating the webinar this morning. So Science Week, for anyone that doesn't know, is running all this week from the 12th to the 19th of November, and it essentially tries to engage the public with science and explore what science has to offer. And this year's theme is human ? So this is examining what it means to be human in today's world and how the decisions we make today will impact on our future. To mark Science Week, our department are hosting a number of events. So besides this webinar today, we have a conference tomorrow on agriculture and climate change. And on Friday, we have another event. So registration is still open for this. If you want to register, you'll find the link on the department's social media channels. And that will be about the Codex Alimentarius, which is an international food safety and food standards organization that Ireland is involved in, and all of the food standards it sets are heavily influenced by science. So it links back to Science Week in a nice way and very relevant to the topic of human ? Just a brief word on us as a research and science funder. So we account for about 11% of all government expenditure on research when you take what we fund in our competitive research programs, along with our state agencies, Teagasc and the Marine Institute. And we fund research across all aspects of agriculture, food, forestry, and the bioeconomy. So for today's event, we've chosen the topic of vitamin D. And why have we chosen this? Well, vitamin D deficiency is actually a very common occurrence across the population. Obviously, we have limited sun in Ireland, which is an important source of vitamin D. So that's one issue. Also a further issue is that our dietary intake of vitamin D is insufficient. And this has important implications for things like bone development, functioning of the immune system, and muscle function. So it's generally agreed that the prevention of vitamin D deficiency is a national public health priority. Since 2010, we've been funding research in this area. We've committed over €4.5 million to research on vitamin D, and particularly how it can be addressed through dietary interventions, such as fortification of foods. And one of the key recipients of the research funding is Professor Cashman. So we're delighted that Kevin could join us for the webinar today. Kevin is a professor of food and health at University College Cork. He's the current co-director of the Cork Centre for Vitamin D and Nutrition Research and is an endowed chair of food and health at UCC. He's also a member of the FAO WHO expert group on nutrient requirements for infants and young children under 3, and he sits on the scientific committee of the Food Safety Authority of Ireland. Kevin has been researching vitamin D for a long number of years, and his work has contributed to the current understanding of vitamin D requirements in Ireland, factors affecting our requirements for this, and finding evidence-based dietary approaches which can help us to reach required levels. So I'm going to give the floor now to Kevin for his presentation. He'll have about 20 minutes to go through his slides, and we'll take questions after that. So if you're not familiar with this GoToWebinar platform, you can type your questions into the question box throughout the webinar. So please do that. You don't need to wait until after the presentation. You can be putting your questions into the question box as we go through it. So with that, I'll hand over now to Kevin.
Thank you, Carol, and thank you, Helen and colleagues, for this invite to give a presentation on vitamin D and public health. I'm going to just turn off my camera for the presentation and I'll turn it back on at the end. So as Carol said, this is part of the department's contribution to Science Week in Ireland, which is a key initiative. And what I'm going to do just with 3 slides by way of recap and reminder is to talk you through, just get the slides to move me, just talk you through a few of the reminder aspects about vitamin D biology. And Carl has touched on a couple of these. So we make vitamin D in the skin when the skin is exposed to UVB-rich sunlight. That's one way we get access to it. We also consume vitamin D in some of our foods. And if we do consume foods containing vitamin D, it's absorbed across the gastrointestinal tract. There are caveats about both of those sources, which will come up later on in the presentation. But for the moment, irrespective of whether you make it in the skin or you consume it in the diet, it makes its way into the blood. But the vitamin D in the blood isn't biologically activated, so it needs two more things to happen in the body. Firstly, it needs to go to the liver, and in the liver, we have enzymes which will modify it chemically. It'll just add a hydroxyl group. You can see that on the slide. It's just an OH group. Add that onto the vitamin D molecule. It's still not activated. But that molecule is useful to us in science and in medicine because it can tell us about your vitamin D status. So you'll see that coming up again in a few minutes' time. So before vitamin D is fully activated, it needs to go to the kidney, and in the kidney we add one more hydroxyl group. And now the vitamin D is activated. It's ready to do its biological functions. And the activated form of vitamin D, shown in the little cartoon on this slide in yellow, when it gets its way into certain cells within the body, it will bind to a vitamin D receptor, and that's like a lock and key mechanism. When the vitamin D binds to the receptor, they'll make their way to the nucleus of the cell, and they'll tell the cell to change its behavior and do certain biological functions. Now, when you look at where these vitamin D receptors are distributed throughout the body, you can see there's a big long list of areas and tissues within the body where we express these vitamin D receptors. That means we have a lot of different tissues in the body that are capable of interacting with vitamin D. But if vitamin D is scarce and deficient, it means we have a lot of tissues that may be deprived of vitamin D. And no surprise, the consequences for vitamin D deficiency have become quite a long list, because any of the tissues that have the receptor potentially could be impacted negatively by having vitamin D deficiency. And you can see here on the list from the Institute of Medicine, big long list of potential things that are linked to vitamin D deficiency. The evidence for this big long list is quite variable. By far the strongest evidence that we have at the moment is that vitamin D deficiency will affect your bones, your muscle, and potentially your risk of respiratory infections. Not to say that the other things on the list don't happen, it's just the evidence isn't as strong as bone and maybe respiratory infections. So with those couple of slides by way of kind of background, what I really want to do now is kind of take the topic that I've been asked to talk about head on. And is vitamin D deficiency a public health problem? And the way I'm going to approach that is I'm going to give you data for Ireland, but to frame the Irish data, I'm also going to give you data from North America, Canada, and the US, as well as Europe. And that will allow us to do some benchmarking or some comparisons of the Irish data to see. So if we start with North America, and again, the metabolite or the form of vitamin D that we form in the liver, while not biologically active, helps us to look at vitamin D status. And generally speaking, what we do is to see if your blood levels are below that value on the slide there of 30 nanomole per liter, you have risk of vitamin D deficiency. So what we really want to do is to see within the population, what percentage of the population have levels below this cutoff. And you can see, if you look at the Canadian population data, about 9% of the Canadian population have serum levels below that 30 nanomole per liter threshold. Now, the Canadian population is quite diverse. It has ethnic subgroups. So for today's purposes, if we just zone in on the white Canadian population, you can see it's about 6% of the Canadian population. Go down a little bit into the United States and ask the same data. About 5% of the entire American population have levels less than 30, so therefore risk of vitamin D deficiency. But again, the American population, again being ethnically diverse, if you go into just the white American population, it's about 2%. So much, much higher in Canada than in the United States. Jump across the Atlantic and come back to Europe. And as part of the UCC-led European framework project a few years ago, we tried to quantify for the first time the prevalence of vitamin D deficiency in our own continent, and we found that about 13% of Europeans have levels less than 30 nanomole per litre. Now, as you move around Europe, it's a big, long continent, that estimate can go up and go down, so 13 is about an average for the continent, but still we didn't have that data. So we're nearly twice as high as Canada, and we're nearly 6 times higher than the data for the white American population. And this data was largely from white Europeans. So Europe is doing much, much worse compared to North America. Jump back to our own island, and as Carol said, we were very, very lucky that 2 of our national surveys funded by the Department of Agriculture over the last number of years have had the ability to take blood samples and therefore measure vitamin D status. So we have data for Ireland, which is really, really important. So in our adult population, we have 12% of adults with serum levels less than 30 nanomole per litre. That, if you translate it into numbers, would mean 1 in every 8 adults in Ireland. And recent data from the teenage survey in Ireland suggests that there's 22% of teenagers in Ireland with levels less than 30 nanomole per litre. That's 1 in 5 teenagers. Now, some people internationally use a slightly different cutoff. They're worried about the percentage of people less than 50 nanomole per litre, which is probably more marginal or mild deficiency, or some people refer to it as low vitamin D status. And you can see, if you look at these 2 surveys, just either side of 50% of the population have levels less than 50. So we do have lots of deficiency and low status within the population. You can take these estimates and take the recent data from the CSO for the population in Ireland from last year, I think, and you can do back of the envelope calculations, and it looks like about 600,000 teenagers and adults in Ireland have levels less than 30, so therefore have risk of vitamin D deficiency, and about half of the population, 2 million of, again, teenagers and adults have levels less than 50 nanomole per litre. And you may ask the question, why? Why do we have such high numbers of people with levels that are low? And it's because we have in Ireland about 5 months of the year where the sunlight does not have enough UVB rich rays to allow us to make vitamin D in the skin. And we refer to this 5-month period as a vitamin D winter. So we can't make vitamin D in the skin. These months coincide with the winter months, as you can see in the little graph on the slide. Any month that's below that red horizontal line means you probably can't make vitamin D in the skin during those months. So it's really from about November to about mid-March. So that's our vitamin D winter. So we're disadvantaged in a sense because we can't make it in the skin. And I can hear you saying, didn't he say we can get it from the diet? Absolutely, we can get it from the diet, and we consume the diet 12 months of the year, so you'd imagine we have a safety net. However, when you do look at the diet from an Irish perspective, we don't have very many vitamin D rich foods in our diet, and that leads to an intake on average in the Irish population of about 4 to 5 micrograms per day. That's relatively low. In fact, about 8 to 9 out of every 10 Irish individuals have intakes that are considered to be below what's recommended. So we can make it for 5 months of the year, and our diet is relatively low. We're not unusual. This slide just shows you lots of different European countries, Ireland flagged there in the middle. And as you can see, as you move around Europe, our intakes are not too dissimilar to other European countries. The standout countries in Europe that have good intakes are our Nordic neighbours. They do fairly well compared to the rest of us, but Ireland are kind of bang in the middle with relatively low intakes. So we have to make some considerations about how do we bridge the gap between what we're consuming currently and what is recommended. And we're very lucky that the World Health Organization, together with the Food and Agriculture Organization in 2006, issued a report and guidelines for how you address too low an intake of some of these micronutrients like vitamin D and others in our diet. And what they've suggested is that there's 3 possible strategies that each country should consider in their own terms. The first one is to put more vitamin D rich foods into the public's food chain, into our diet. That is difficult to do because we just talked about there aren't that many foods that are rich in vitamin D. So it can be done and it's part of our healthy eating guidelines, but it's difficult for it to have a big impact. Supplements containing vitamin D, if you take them, will absolutely improve your vitamin D status. No questions about that once it has enough vitamin D. But at a population level, our national surveys tell us that that nearly 80 to 90% of children, teenagers, and adults in Ireland do not consume a supplement containing vitamin D. So you have only about 10 to 15% of the population that are getting vitamin D by supplementation. So again, at a population level, it will have limitations. The third option is food fortification. And in fact, the WHO, FAO have food fortification as their preferred option from an interim, long-term basis because of its impact. We all consume food. If we get the nutrient into food through fortification, a lot of the population will get an advantage. So that's where I want to just focus the last part of my presentation on, which is food fortification. And the evidence that food fortification works is relatively strong. Here's just one example picked at random of a study where people were divided into two groups. One group were asked to consume their normal yogurt that was provided to them for 3 months of winter. So just their normal diet with an extra pot of yogurt per day. As you can see from the arrow, their vitamin D status as they went through winter decreased. Exactly what will most likely happen, lots of us on the call today. As we go through winter, vitamin D status goes down. The other half of the study, the participants were given a yogurt, exactly the same as the plain one, only difference being it was fortified with vitamin D. And as you can see from that side of the graph, their vitamin D status increased, not decreased, increased, showing you how food fortification can prevent vitamin D deficiency and in fact even improve vitamin D status during that time of the year when we need it. And there's dozens of such studies using a whole variety of different foods, as I've just tried to reflect very simply in the diagram here, ranging across a whole range of different foods. One of the challenges, again, going back to what the WHO says, is that while we have evidence from all of these studies and huge numbers of studies, which is absolutely fantastic, it's very, very good evidence, one of the challenges is taking that evidence and putting it to work in a real world environment. So in other words, how do we take the data from studies which clearly shows food fortification works in a study setting and get it to work in our community and our population in Ireland where we need it? Our Finnish colleagues have shown us the way to a certain extent. Here's a study that we were involved with some collaborators in Finland. So they had access to a survey of 6,000 Finnish adults in 2000. We measured vitamin D status in that population and we looked at vitamin D intake. There was about 12% of the Finnish population had levels less than 30 nanomole per litre. That's about the same as what we have in Ireland. Their intake was a little higher, about 7 micrograms per day when you look at food intake. And the Finnish government were worried about this level of vitamin D deficiency. So about 2002 to 2003, the Finnish government introduced food laws, food regulations to say that you need to add vitamin D into the food chain, into the dairy produce and into the dairy spreads in Finland. And this was allowed to progress. Our colleagues had access to a second Finnish survey, but this time in 2011. So this is about 7 or 8 years after fortification has begun. About 4,000 participants, again measured vitamin D status to see what happened. And as you can see, the numbers of the percentage of the population below 30 nanomole per litre dropped to less than 1%. They had conquered vitamin D deficiency. Why? Because you can see the vitamin D intake increased from 7 micrograms per day up to 13 micrograms per day. So this is happening in the population. Remember we talked about Canada? And Canada is as northerly to a large extent as Ireland, but yet only 6% of white Canadians had levels less than 30. In Ireland, we have 12%. Why? Canada have food regulations or food laws where you have to add vitamin D into milk and margarine. So their intakes are much, much higher than Ireland. So even that they have vitamin D winters very similar to Ireland, their intake is compensating for that. So back to Ireland, what do we need to do next to try and help and get the prevalence of vitamin D deficiency down? We still have knowledge and data gaps that we need to fill. And the Department of Agriculture, in their wisdom, funded a project with ourselves as Leeds and UCC, but together with University College Dublin, Teagasc Ashtown, and a food company, Aritza Food Solutions, that make cereal products. And what we're trying to do in this 4-year project, and we're a year into it, is to develop a national framework for vitamin D deficiency. And it's slightly different from projects we've done in the past, and I'll explain why. So the WHO FAO have given very, very good insight as to the type of information that you really need to have to develop a framework for food fortification such that it works within the population. And this is consideration of what foods should you fortify. Have you proved that they'll work? Have you evidence that they're consumed widely in the population? Are they acceptable? Will the public want food fortification? Will the industry want to fortify? And will our regulatory bodies decide that it's a good thing to do? So lots of information that we want to get. So during the first year of the project, we have reviewed all of these studies, these 80 studies that we've talked about in the earlier slide, and whether you go for foods that come from the animal kingdom or plant-based foods, with the exception maybe of UV mushrooms, most foods that you fortify with vitamin D, when you do a study in people, will increase vitamin D status. So the evidence is very, very good. You go to our national surveys and you look at the percentage of people in the population that consume these various foods. You can see bread, for example, between 70 and 99% of the Irish population consume bread. The dairy produce, anywhere between 1/3 and 2/3. Eggs, 1/3 up to 2/3. Maybe orange juice a little bit less. So there is uptake of these foods. So they are good foods to consider. When you look at the literature and see if you add vitamin D into some of these foods, does it do anything to the acceptance of the food? Does it change the taste, the texture? Does it make it any bit more unacceptable to the consumer? The answer is no. So we're making inroads even in the first year that we're filling some of these knowledge gaps that we need to have in terms of developing a strategy, but we still have knowledge gaps that we need to fill over the next 3 years. And just to give you an insight as to what some of these that we need to undertake will be. So there's a fantastic study that has been done in Denmark, which is different to the 80 studies that I mentioned before. It's different because it was done in households. You recruited families and you asked the family either to consume bread and milk as normal that were not fortified, or you gave them milk and bread that was fortified. And they consumed this in the normal household. They put the product away. The children and the adults went and consumed the products over the winter months in Denmark. And then they measured vitamin D status to see what happened. And you can see here on the left-hand side of the slide, the study started around autumn time, where there was no prevalence of vitamin D deficiency. There was nobody less than 30 nanomole per litre because they were coming off the back of summer. Everybody had good vitamin D status. Jump on 5 months as they progress through November, December, January into March, so through winter in Denmark. The group that got the vitamin D fortified food, the bread and the milk, had no prevalence of vitamin D deficiency. So it prevented vitamin D deficiency from occurring. The group that got the non-fortified milk and bread, the equivalent, as you can see, 25% of people had vitamin D deficiency by the end of winter. So it clearly shows in a family structure where children and parents are going to the fridge and going to the bread bin, consuming these foods in their normal way, it seems to have the impact. We need this data for Ireland. We need to have the equivalent studies in Ireland to show that it will work. Will the Irish population like the idea of food fortification? We need to do a survey like this. This is an example of a UK survey where they asked participants about all things related to vitamin D, what they understood about it, but very, very importantly, were you willing to buy and consume fortified foods? And as you can see, 2/3 of the participants said they were. And what's more important is what are the barriers that people were unsure, or even why were people unwilling, and you could potentially address those. The UK government, in 2 summers ago, actually went out to a public consultation in England to ask the English population what they thought about vitamin D and what they thought about supplementation and fortification, etc. That report hasn't come out yet, but that will make for very, very interesting reading. So we need to do some of these surveys in Ireland, and this project will try to do it. So what we're going to do is, you can see the uptake of some of the foods, particularly bread, for example, where it was 70 to 99% of us consume that. We're going to fortify bread. We're going to do it with food technology expertise in UCC and in Teagasc. We're going to make sure that the bread is up to quality, it's acceptable to the consumer. We're going to combine the bread with some other foods, and we're going to do 2 of those studies that we talked about 2 minutes ago and that the Danish people did. We're going to do a study in children and adults to prove that in the family unit these foods will work and improve status, and we're going to do a second study in older adults to prove the same thing. All of this information, which is again filling the data gaps, needs to be distilled down into a plan, into a framework. And you can make a plan or a framework until you talk to the people that have a role to play in that. And that's the public, that's the food manufacturers, that's the regulatory bodies, that's the Department of Agriculture, etc., etc. So we're going to use this thing called a co-design process, where information is garnered. We ask people for their information, we give people the new data that we will find in the project, and we go back and forth so that we develop a framework which we can produce into a document and put it in front of the policymakers. The policymakers will make the decision in terms of going forward. So that's what we need to do over the next 3 years. So just to conclude, a few points. Hopefully I convinced you that vitamin D deficiency, risk of vitamin D deficiency, so when your serum levels drop below 30, is among us, even in high income countries, despite our wealth, and including Ireland. We can tackle deficiency of vitamin D by food-based approaches, absolutely, once we do it strategically and in an evidence-based way. And implementation, taking the available information and trying to frame it in a way that it will work in a real-world setting, is absolutely important, as the WHO has said. So it's not just to have the studies in isolation, we need to get the data and put it to work. And this co-design aspect is really, really important, because we need to have the public's opinion, we need to have the food industry's opinion, we need to have the regulators' opinion, and we put all of that into the melt and devise a strategy that's most likely to bring about change within the Irish population. Thank you for your time.
Excellent. Thanks very much, Kevin. That's great. If you want to come back on screen, excellent. So really, really insightful stuff. And we have questions coming in, so I hope you're okay for me to put some of them to you. Before I get to them, one of my own that you might speak to is this aspect around, let's say, dietary fortification versus supplementation. Could you speak a little bit to that? And I might just bring in 1 or 2 of the questions that have come in kind of connected to it. You know, there's a question here, for example, if you take vitamin D supplements in the diet and you take too much, what are the side effects? There seems to be a big push on vitamin D mega doses. We see these in pharmacies and health shops. Are these recommended? So I'll stop there and let you take that. I've kind of packaged it up as maybe fortification in foods versus supplementation.
Thanks, Carl. No, they're absolutely great questions, and they're you know, the most important question in a sense to start with, because when you do something like supplementation or fortification, your starting point in one sense, you're trying to do it to benefit health. You're trying to increase vitamin D status for all the health reasons, but it's like anything in medicine, making sure you do no harm, and that's where dose comes in. So we've looked at this as part of EU projects, we've looked at it as part of Irish Department of Agriculture funded projects, as you mentioned, going right back to 2010, and you're very unlikely to have any toxic effects from vitamin D food fortification, because you never get to the levels through a food fortification approach that will approach the kind of levels where you might get an adverse effect. Where you can get too much vitamin D, as some of your questions have rightly pointed out, is if you're taking supplements that have high dose of vitamin D. So you can take regular supplements that you buy in a lot of the pharmacies and health food shops. Once the dose is relatively moderate, low to moderate, even on top of a diet that has been fortified with vitamin D, and you're still well below the levels that are considered safe. Where you run into problems is if you're buying supplements that have too high a level, and you're either consuming them on their own, or you're consuming them on top of a diet that is supplying vitamin D through fortified foods and natural foods as well. And there is some very good guidance from the Food Safety Authority of Ireland on accessible reports. If you go into the reports and you search their website under vitamin D, and you'll see the levels that are quoted is, let's say, for example, 100 micrograms for an adult, you shouldn't go above that. So what you can do is, if you're taking your vitamin D supplements, check to make sure that it definitely doesn't exceed 100. And ideally, you probably don't even need to take 100. You can probably take something below that. So the guidance is there. It just needs the person and the people in the public, if you're taking supplements, to check against the cutoffs to make sure you're not exceeding it and you're not consuming too much. If you have very high intakes, and probably even higher again than that 100, you do run the risk of hypercalcemia, so too much calcium making its way into the blood, and some of the tissues then start accumulating calcium. Now, this 100 micrograms per day has been set such that if you're consuming up to that, you have very, very low risk of hypercalcemia. So really, it's a responsibility on us all that if we are taking supplements, just to be aware of the dose and to look at the guidance from the Food Safety Authority as to what we should be below. So 100 micrograms per day for adults. For children, it's a little bit less. So if you're giving children supplements, you even have a lower threshold. I think it's around 50 micrograms per day. And if you go right down, maybe even a little bit lower again. So again, they're published, and just to check the supplements that you're taking relative to those thresholds. If you're below it, you're absolutely fine.
Okay, and Kevin, how would you know if you're deficient? Like, is it best determined by a blood test, or are there symptoms?
So the only way you'll definitively know is you get a blood test and you get that metabolite, that form of the vitamin that's made in the liver. You get the value and you benchmark it. Am I below 30, or am I below 50, or am I over it? And the clinician or the nutritionist will make that judgment for you. Do you really need to do that? If you have health concerns and your GP think that it's important to have vitamin D status measured, he or she will recommend a test to be done, and that will be done in conjunction with the hospital. If you're worried about vitamin D intake and status, the way I approach it, without having to go down a blood test, is ask yourself, am I consuming foods like fish, eggs, meat to a certain extent during winter time? And if the answer is I don't consume much of those, am I consuming fortified products, breakfast cereal, milk, orange juice? If I'm not consuming those, and we're going through, as we are at the moment, 5 months of winter, there's no harm in assuming that your vitamin D intake is going to be low, your vitamin D status is coming down, and that if you want to take some kind of precautionary mechanisms, you either go out and seek foods that are rich in vitamin D, fish, etc., or buy foods that are fortified in vitamin D and introduce them into your diet. The other option is you can go out and buy supplements, as we've talked about. Absolutely will be fine, just to be aware of the dose. So, a supplement, anything containing 10, 15, 20 micrograms is probably more than enough.
Okay. And just for everybody watching, we're a little bit over time now, but there are a number of questions I'll get through here, so we'll spend about another 5 minutes or so on questions. So just to work down through these, and you mentioned fish, Kevin, and there's a question here that says, I assume the high rate of vitamin D in the Nordic countries is due to the high consumption of oily fish. Are there other types of foods that are having an impact?
Yeah, so the Nordic countries are the best in class in a sense. They're the people that get the great report card compared to the rest of us. It's not as simple as that. For some countries, for example, Norway, yeah, and yeah, Norway and maybe Iceland, they're certainly consuming way more oily fish than we're consuming, and therefore their vitamin D intake is higher. But the adult Norwegian population have an extra thing that used to be the case in Ireland, that they consume a product that's made from cod liver oil. And that's giving them almost a natural supplement during winter to increase their vitamin D status. So they're taking almost waste streams from the fish industry and incorporating it into a food for all the world, like cod liver oil tablets that used to be common in Ireland if you go back in time. So that's how Norway and Iceland's status are good. There's also probably more awareness about taking supplements. So they probably have a higher uptake of supplements than we have in Ireland. Finland, it's actually through food fortification. So if you go out, you buy a bottle of milk, or you buy, you know, a spread for toast and for butter, for bread, etc., all of that will be fortified. So it's not just fish in Finland, it's more that the dairy foods are fortified on purpose to get the vitamin D intake up. So there's a number of reasons why the Nordic countries are doing well. Absolutely, the fish intake is way better than it is in Ireland, but some of them have made strategic decisions to actually put vitamin D into foods that are not naturally rich in vitamin D, milk, for example, and butter.
Okay, and just on that vein, I mean, are some foods better as carriers for vitamin D fortification than others? You mentioned bread a few times, and I think you gave a list of the food items that are being included in the study that we're funding with you. Maybe just speak to that.
Yeah, so the food vehicles, that whether it is bread or milk or orange juice or breakfast cereals, once you put vitamin D in, the evidence from the human studies where you feed them to people and look at their vitamin D status seems to suggest that the vitamin D is getting across the gastrointestinal tract into the blood and doing its job. So there's no major barrier to actually putting it into different types of foods. Some foods will have challenges that others won't. So for example, if you put it into bread, when you're cooking bread, you'll get some losses due to the heat, but you can account for that. You can put it into orange juice, but because orange juice is quite acidic, sometimes the vitamin D degrades as well. But the industry, the food industry that would be doing this, have the wherewithal from a technological perspective to get the vitamin D in at the levels that we want. So there was always concerns that bread, particularly, you know, more fibrous breads like wholemeal breads, that the fiber in bread might interfere with the vitamin D being absorbed. Doesn't seem to be the case. So food helps to deliver the vitamin D into the bloodstream in a very efficient way. And there's been one or two of those studies that I mentioned out of the 80 that we've looked at, where they've done a comparison, put a certain amount of vitamin D into bread and give that to people in a study, take another group and give them the exact same amount of vitamin D, but as a capsule, as a supplement, and see how they fare. No difference. So it just shows you can do it from a food perspective once the manufacturer produces it, and it seems to have the same outcome in terms of improving vitamin D status. So food is a good vehicle.
Okay, we might just look at the regulatory aspects of this then, and there's a question here around what legislative measures are in place to ensure supplements and food fortification contain the levels advertised on the products. How can consumers ensure they're getting what they pay for, and will school meals be fortified?
Okay, so I'll take the last one first, because the will school meals be fortified comes into the remit of the policymakers. That won't be a decision for us. I think the policymakers will look to see the data on that food could be a way forward, and then they'll decide if they want children in Ireland to increase their intake. That may be a very solid way of doing it, but as I said, that won't be a decision for us. How do you make sure that the level of vitamin D in the foods or in the supplements is up to scratch? That's again coming in under food laws. So you have to make sure that what you claim on the label is actually there. So that can be audited, that products can be pulled and tested to make sure that what's on the label is actually present in the food. So I think you can take it that you'd have a high degree of confidence that the amount that should be present, certainly in the food chain, would be there, because it has to be analysed as part of the quality control measures from the food industry. And likewise with the supplements, with one caveat that, you just have to be careful that as we live in an internet age, you can buy things over the internet. And again, it may be that when you're buying it from markets that we're less familiar with, there may be potential that that may be breached. Buying the supplements, I think, from tried and tested providers, you'll have a high degree of confidence that the levels will be as stated on the label.
Okay, and look, I think I'll take one last question because we are running quite over now. So if you have a vitamin D deficiency, how long does it take to get your levels back up?
Oh, it responds really quickly. So if you have low levels and you start taking supplements or fortified foods, or you increase the intake by whatever means or a combination of means, typically the response will be within weeks. So you'll start to see the improvement even by week 2. Probably it'll take about 6 to 8 weeks before levels kind of get up to where they need to be and then plateau out. So it's not a protracted thing. It'll happen really, really quickly. So if you think your vitamin D status is decreasing as you go through winter, during the winter months is the time to tackle it, and your status will come back up. And then it's a decision, as we head into summer, a lot of us get, sun exposure, not even on purpose, just incidentally as we're walking around, and we get some of our skin exposed. And usually what you find, the Irish population vitamin D status begins to increase throughout the population during summertime. It's only if you are avoiding sun exposure altogether, or you're housebound, or you're working in an environment where you don't get much outside exposure during summertime, that you need to be conscious again of maybe keeping your vitamin D intake high.
Okay. Kevin, I think we'll leave it there. There are other questions that we didn't get to, and just from looking at them, a lot of them relate to, let's say, the medical aspect of this, and I guess people should always consult their medical professionals and put a lot of those questions, more detailed questions around supplementation and for various different age categories and other similar type questions, put it to your medical professional. As Kevin said, there is information available on the Food Safety Authority of Ireland website, so you should go there. Kevin, they probably can find information as well from your own centre in UCC, so we could direct them to that as well. Okay, with that, we will conclude. I want to thank Kevin in particular for giving his time to the webinar today. It's been really, really useful, and it gives a good flavour of the type of research that we get involved in our department. We're coming at this very much from the point of view of food fortification, and we're delighted that Kevin is leading that project for us. So I wish you the best of luck with the remaining couple of years that's left in that, Kevin, and we look forward to the outputs of that. For people tuning in, if you want to find out more about research that we fund and access end of project reports, they're all available on our research dashboard. So if you go on to the department's YouTube channel, you'll see a video there on how to engage with our research dashboard. And as I said at the start, if you want to register for the webinar on Friday around food safety standards, you can still do that on our social media channels. So with that, thank you all for tuning in, and thank you, Kevin, and enjoy the rest of your day.
Thank you.